Hello everyone, I am Dr. Ziyad, MBBS, MD in Health Informatics. I am also specialized in clinical terminology and medical coding. In this tutorial series, I will walk through Model Paper 1 for the AAPC CPC examination. I will share quick techniques to find answers very easily, along with the detailed explanation to help you to understand the key concepts. Certified Professional Coder, that is CPC exam, evaluates the proficiency in medical coding through 100 multiple choice questions covering 17 key knowledge areas. Model Paper 1, Chapter 5, ICD 10cm coding. This section will consist of 5 questions. This section will test your proficiency in diagnosis coding within the chapters of ICD 10cm as well as through the knowledge of ICD 10 official guidelines for coding and reporting. Additionally, diagnosis questions will appear other sections of the exam from the CPT categories as well. Question number 1. A patient is diagnosed with diabetic polyneuropathy. According to ICD 10cm coding guidelines, which codes should be reported? Here 4 codes are given. So please pause the video for a few seconds and take your ICD 10 code book and find the answer.
3, 2, 1.
So let's see the answer. In this case, you can see E10 code, E11 code and G62 code. There are 3 codes used. So for this MCQ, you can directly go for the elimination method to find the answer. So in this question, the patient having diabetic polyneuropathy. If any diabetic patient, the type 1 or type 2 is not mentioned, by default you have to take it as the type 2 diabetes mellitus. That is the rule 1. If mentioned as diabetes, it is equal to type 2 diabetes mellitus. So let's see the codes. E1042, that is type 1 diabetes mellitus with diabetic polyneuropathy. E1142 code is type 2 diabetic mellitus with diabetic polyneuropathy. E109, type 1 diabetes mellitus without complication. E119, type 2 diabetes mellitus without complication. So here you have to decide the answer whether it's 1042 or 1142. 1042 is type 1. 1142 is type 2. So in this scenario, the type 1 or type 2 is not mentioned, but by default you have to take it as type 2 diabetes mellitus. So the correct answer is D, that is E1142. In the real working scenario, you have to find the answer by going to the ICD 10cm index. So go to the index, go for diabetes, then go for type 2. There you will find polyneuropathy. It will indicate the code E1142. Then you have to go back to the tabular list and confirm the diagnosis. So again, you will find the correct answer is D. Question number 2. A patient presents for an intercostal nerve block to manage severe pain due to metastatic cancer to his lungs. According to ICD 10cm guidelines, which codes accurately represent this scenario? So there are 4 answers. So please pause the video, take your ICD 10cm code book and find the answer.
3, 2, 1.
So for this question, you can find the answer in 2 ways. One way, you can go to the alphabetic index of the ICD 10cm codebook and you can find the answer, but it is time consuming. For this MCQ, you can use the elimination method. So you can see there are only 3 codes: G89 code series, C34 code series and C78. So you can check those 3 codes and you can find the answer. So in this question, the patient came to the clinic for severe pain due to the metastatic cancer. So the reason for this encounter is pain management. Pain in neoplastic is the first listed diagnosis. So let's go and check the G89 codes. So G8912 is acute post-thoracotomy pain. So that is not related to our case. So G89.3 is neoplasm related pain, acute or chronic. So that is the first diagnosis of our case. So you can eliminate other A and D. So those are not suitable. So now you have to select the answer from B and C. So let's check the C codes. So when you check the C3491 is malignant neoplasm of unspecific part of right bronchus or lung. 92 is malignant neoplasm of unspecific part of left bronchus or lung. But C7801 is secondary malignant neoplasm of right lung. C7802 is secondary malignant neoplasm of left lung. Here, there's no site is mentioned, but it says metastatic cancer to his lungs. His lungs is plural, mean there are right and left involved. So you can select this C78 as the diagnosis codes. So for this question, the answer is C. That is G89.3, C78.01, and C78.02. So if you go for the real world scenario, you have to go to the index. So in the index, first you have to find the code for the pain. So here, go to the alphabetic index, go to pain. There you have to find due to malignancy, primary or secondary. It will lead you to G89.3. You have to go back and check the tabular list. Likewise, the metastatic cancer, you have to look in the table of neoplasms for neoplasm, then go to neoplastic lung and use the code from the malignant secondary column because the cancer is metastatized to his lungs, making it secondary. So it will lead you to the C78 code. So in the tabular list, there's no code for bilateral. So both the right and left lung are reported separately. Question number 3. Mr. Pereira had polyps removed on a previous colonoscopy. The patient returns 3 months later for a follow-up examination for another colonoscopy. No new polyps are seen. What diagnosis coding is reported for the second colonoscopy? So please pause the video and take your ICD-10 code book and find the answer.
3, 2, 1.
Okay, in this scenario also, we can use the elimination method to find the answer. So here you can see there are 3 codes, Z09, Z86 and K63.5. So let's check the answers. So before going to the answer in the questions, there are 3 things you have to note. First thing is polyps removed on a previous colonoscopy. Second thing, now the patient came for the follow-up examination. In the follow-up examination, there's no new polyps. So when you check the Z09 code, it says the encounter for follow-up examination after completed treatment for conditions other than malignant neoplasm. So these polyps are not malignant neoplasm. So we can use the Z09 code. So in this case, we can eliminate B and C answers. So only A and D available. So here we can check the K code, K63 and Z86. The K63.5 says polyp of colon and Z86.01 says personal history of benign neoplasm and 86.010 says personal history of colonic polyps. So this is a tricky part of the question. So here both the answers seem to be okay, correct. But in this case, Z86.01 personal history of benign neoplasm. Question number 4. What ICD-10-CM code is reported for a patient who is a habitual abuser of cannabis? So there are 4 codes available. So please pause the video, take your ICD-10-CM code book and find the answer.
3, 2, 1.
Okay, in this case scenario, you can see all 4 answers. All 4 answers are based on F12 code. So you can directly go to the F12 code and find the answer. So when you go there, you can check all the codes. F12 129 is cannabis abuse without intoxication. Here the patient is habitual abuser of cannabis. It didn't say any dependence or any complication or nothing told there. So you can omit this answer. F12 159, that is cannabis abuse with psychotic disorder, unspecified. So psychotic disorder not mentioned in this case, so you can omit this answer. C F12.10, that is cannabis abuse uncomplicated. So you can take this answer. Again, D F12 121, that is cannabis abuse with intoxication. So the intoxication or the psychotic disorder not mentioned here. So the answer will be C, that is F1210, cannabis abuse uncomplicated. But in the real world scenario, you have to go for the alphabetic index of the ICD-10 code and you have to find the answer. So if you want to find the answer directly from the alphabetic index, go to the index and look for abuse, drugs, cannabis. So go for abuse, then go down to drugs, then go for cannabis. It's guiding you to the subcategory code F1210. So then you have to go back to the tabular list and have to verify it. So the answer is C. Question number 5. A patient with hypertensive heart disease is now experiencing accelerated hypertension due to papillary muscle dysfunction. What ICD-10 codes are reported? So please pause the video, take your ICD-10 CM code book and find the answer.
3, 2, 1.
Okay, in this scenario, there are three codes used: I11, I10, and I51 codes. So you can use the elimination method to find the answer quickly. Okay, so let's see the question. It says hypertensive heart disease, accelerated hypertension due to papillary muscle dysfunction. So let's see each code. Code number I119 is saying hypertensive heart disease without heart failure. I10 says essential, that is primary hypertension. I11 I already said. I5189 says other ill-defined heart diseases. See official guidelines, hypertension with heart disease like this. And answer D says I10 and I5189. So it's a complex answer. How to find the definitive answer here? So here you have to use the ICD 10 cm guideline. So in the guideline says section 1C9A1 heart conditions. So as per the ICD 10 cm guideline says section 1C9A1 heart conditions, that I52, I51.4, I51.9 are assigned from category I11. When a causal relationship is stated due to hypertension or implied hypertensive, the same heart conditions with hypertension but without a stated causal relationship are coded separately. So in this scenario, we can code only the I11.9, that is hypertensive heart disease without heart failure. So the answer is A. So if you are using the alphabetic index to find the answer, go for hypertension due to heart disease, and it will lead you to I11.9. So this will be the only code to report, since there's a causal relationship between the hypertension and the heart disease. Now you can verify it in the tabular list as well. So if you are preparing for the AAPC CPC examination, my channel will help you to solve the problems you are facing in your examination preparation. So please subscribe my channel. And if you have any doubts or any questions, you can put in the comment section, or else you can email me, or you can WhatsApp me to the email and the WhatsApp number displayed here. So please subscribe my channel and stay with me. Thank you.